Okay. One finger's up. The fingernails are long too, so if I cut you, can you just rub that out of the video? All right, so Achilles, just quickly before I take the ankle, you guys, do you really want to sit there? You want to come around close? I would. Okay, come down here for me. Okay, so yeah, while I'm getting ready to take the ankle a different way than you used to, Achilles. Let me just go straight to the cut to the chase. What sort of tape would you think to use for the Achilles?
Active.
Oh, Tim.
Like you've done myself from before.
Well done.
Well done, mate. Unbelievable. Your job's done for the day.
Appreciate it.
Okay. So let's just start with the basic ankle, and let's look at a concept that's a little bit different to probably how you've taped the ankle in the past. Now your foot's a little bit little. I usually work with a 50 mil because I get greater purchase on the angles, okay, and the sort of the force vectors I want to try and change. So I like to use a 50 mil, but this is going to be a bit of a challenge because your foot's small, but I love a challenge. So with the ankle joint, obviously the lateral malleolus sits lower than the medial, okay? So if it sits lower than the medial, it means it's going to abut quite easily, okay, because it sits lower. The medial sits higher, which means there's more room for excursion, okay? So that's where we obviously want to protect laterally, and there's a few structures we want to protect. What are the structures we want to protect?
The ligaments?
Yeah, ligaments. Yeah, anterior inferior tib fibs around there. Perineal tendons. But we also forget about the bifurcate ligament in the midfoot as well, okay? So you want to consider that. So there's a few things there we want to look after. Retinaculums, they're really important. Once you tear a retinaculum, you're in a boot. You know, we saw that young Henry go through that. So there are a few structures, which means that we need to consider if we're just doing a basic ankle taping, it's probably not enough for some things. Yeah, we generally just do a basic ankle taping. All right, so now, this tape's a little bit stiff because it got cooked in a car in Malaysia, so I might be pulling and tugging. So with my anchors, I don't go too high like you guys, okay? So I don't like to go too high, and the reason why I don't like to go too high is that if you're using a pretty good product, you don't need to. I mean, the whole thing about a high lever is, yes, it does provide more support, but generally that sort of lower calf, not going into the gastrocnemius is really important. Don't go too high, because once you start to restrict that function, then, you know, it's not what we want. We don't want occlusion. And when you do plantar fascia taping, that's a really good example. If you tape too tight with that, they stand on the ground, they ain't walking, or they're going to tell you they're not going to be happy doing anything. So, okay, so that's my first one. So then here we go. So what am I doing here? I know these are really easy questions, but it will all make sense shortly. What's this? What's this one? Anyone? Stirrup. A bit too high, but it's all right. We all make mistakes. Okay, so that's a 50. I'll just cross over that just a little bit more again, and the reason why I'm doing this will make sense in a tick. Right, so this is what I call, so this is actually a secondary anchor for me, the way I tape. Do you teach the, yeah? Yeah. Okay, and then I set up a tertiary anchor. Oh, that's been cooked. So, right, so what we do here, tertiary anchor. So what I'm doing here is, if it goes obviously down this far, I'm considering more than just the rear foot. Okay, so I'm looking for some other things I want to support as well. Okay, so this is what I call this is my tape system, so my anchor system. And so within my anchor system, sometimes you don't need this rear one. If you're just looking for prophylactic care, who said prophylactic prevention? So, someone did. You did. Someone did. So for prevention, I'm not going to go so aggressive. But if someone has a lot of dysfunction in a number of tissues, and in particular, if you think about perineal tendons, which can cause a lot of shit. Like once the fluid gets in, it's hard to get out of those tendons. The actual the tendon, as you know, the brevis goes into the fifth mat, okay, and then you've got one of the hooks underneath. So sometimes the rear foot doesn't capture all that tissue load Okay, remember I go back to load. You've got to manage load. So let's think that I've got that issue. I'm using my tape anchor system. Okay, so from there, what I do, so when you tape traditional taping with your 38mm, you generally, rigid tape's stubborn as buggery, right? You've got to follow, you have to do what it wants to do. You can't, if you try and change the way it wants to move, guess what happens? It's the worst taping job you've ever seen, and I see it all the time. So if you tape here and then suddenly, I want to go there, you get crinkles and all that sort of crap, and I find it's a waste of tape, even though I do like people to buy tape. So I look at it a different way. I like to use different force vectors, given that the rear foot's quite complicated in terms of the subtalar joint, to provide stability in different planes, which gives me confidence that this ankle is stable. Okay, so I use a 50mm. I'm getting away with a 50mm so far. Yeah? You happy with that?
Yeah.
Good. Just checking. It's very rare that you can actually take tape backwards. Does that make sense? You just want to come down just a little bit more for me to make sure your foot's in dorsiflexion. Oh, see? I didn't say that earlier, did I? You've got to make sure they are in dorsiflexion. And because I'm talking, I let it slip down. And the best way to know if someone wasn't in dorsiflexion is that. Okay, so that's my fault. Okay, so best thing about tape is you can always go over your mistakes and recover. Right, so I applied 2 or 3 of these 50mm, and it's a really, really, really nice way of taping, functionally, because you're looking at a very complicated rear foot. Now this is subtalar. I'll just provide one straight up as well. Okay, so there's 3. You can feel I'm providing tension there, but I'm not really winding that up. I'm not like, I see people who just want to just load and load and load crank it. And if they're cranking it, they're probably not using a good tape. And they're worried it's going to slip. Okay, so that's effectively, that's my lateral system. But what I'm going to do is I'm just going to peel back 2 of these. Is that the second one I did? Yeah. What I like to do, if I'm considering my full complex, there's that bad one. So using this system as well, I'm going to do effectively a modified basket weave. So not the traditional basket weave, which is just the basket weave is coined by the Americans because they just love to use so much tape. So what I do is, this is like a secondary stirrup, so it's too long. So basically I get the foot back in dorsiflexion, I put my fingers here, I put my finger underneath the calcaneum posteriorly. You can feel that little bit of traction there, okay? So I lay down the tape. Okay, I don't put any tension on the distal Achilles insertion, so because of compressive issues. And so then I go 1, 50mm.
Yeah.
Ah, that's 38. What about the other 50mm? Ah, it's hanging. Okay, so I'll do 1, and I'll work between the 2. Thank you for your dorsiflexion. Okay, so I'll lay down my stirrup, and I'll weave between the 2. Creates a lot of stability, and it means that you're addressing your perineal tendons going distally on the rear foot. Okay, so then I might do 2 or 3s of this sort of interweaving technique, dorsiflexion. You're up. Thank you. Okay, so then I might do 2 or 3 of those. Okay, so that's the system there. And then from there, I'm generally happy with that. What I apply is just 1 or 2 medial. We all know there's a lower risk of medial sprain, but it is real, and you don't have to put a lot of tension on that. You may as well prevent it while you're there. There is no study that shows that taping causes a decrease in proprioception, those sort of things. There's no study. And if there was, you'd have to wear it all the time. You'd have to completely switch the system off. If it's during sport, there's no biggie. Okay, so.
Do you comment on that as like in answer to people going, will I become reliant on this? Is that what you mean?
Yeah, so I say there's two reasons why you may become reliant on it. It's psychological, and it's also truly dysfunction of the system. Yes. Yeah. I say someone can put that in your brain, and we know the brain's a powerful tool.
Yeah.
So I never do that, and I always tell someone when I'm taping them, especially shoulders, after they come post-dislocation, I go, you're not going to need that tape once you're done, so you're really going to be in a good place. But some people tell them, you might have to wear tape for 3 years, and they just can't get it off. Wayne Carey was the classic one. He just kept wearing tape. I think he still wears it under his shirts. It's a dad joke. Did you get that one? You happy with that one? Okay, all right. So that's my tape system. I lock it off. Why did I put the white tape on?
Prevent tape cuts.
Fantastic. Where did you come from?
I just walked off the street.
Fantastic. I thought so. Okay, just making sure I didn't forget anything. So now we're doing our heel locks, all right? So I've got a bit of heel lock. Always a bit harder with the 50. One thing about a heel lock, don't put a lot of traction behind the Achilles. I see people like literally fasciculating because they're trying so hard. You don't need to do it, okay? It is hard with a 50mm, but I'll see if I can pull it off. With a 50mm tape, as I said, tape's stubborn. If I try and go that way, see what happens. If I try and go that way, see what happens. So generally the best way to get away with it is just to pull the tape. See, as soon as you pull it, you just got that little bit of, I suppose you get cleanliness, or it just creates that tension whereby you're probably going to avoid having a crease. So this week you have to try and tape with a 50mm heel lock. Or maybe video it and send it to me. Okay, so come around again here. So she's got a little foot. I've done pretty well there. Come around, just pull the tape a little bit. Okay, and then we just come up. And we've got our tape cut preventer underneath, just to fix it, so happy days. Whoop. Okay. And then you've got to lock off your distal anchor. Here's one I prepared earlier. Keep losing my tapes. Alright, so we'll get you up, have a bit of a walk. So, I know this is telling you how to suck eggs because most of you know how to tape, but whatever you do, don't tape over to the 5th met, okay? Basically because you're just going to cause them to be shitty as hell. Okay, alright. Have a walk. Tell us what you feel. Have you been taped before, Sherry?
Yeah.
Oh, okay. You can walk like that. Be normal. Does that feel stable?
Yeah.
Yeah. Feel supportive?
Mhm.
Yeah. Just try and roll your foot out for me.
Okay.
Good.
Good answer.
So what you find